Madam Speaker, 5 years in, this government still is not meeting its own emergency room targets. In some cases, they're getting worse. According to the government's own report, Action for Health, released last month, there are 3 major areas of concern. More people are waiting too long when they visit an emergency department. More people are waiting too long for EHS when they call 911. And more paramedic crews are waiting too long to offload patients at ERs. Can the minister explain to Nova Scotians why this government is not meeting its own targets for ER services after 5 years?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So certainly, I think there's a lot of positive stories. We're moving in the right direction. Perhaps targets are not always met, but we are trending in the right direction. We have seen an improvement in the wait times in our emergency rooms, and certainly those folks that wait, we know it's frustrating. There are other ways for them to seek care, looking at urgent treatment centres, looking at virtual emergency rooms. Folks who wait the longest generally have low triage scores. We understand it's frustrating, which is why we've created 70,000 appointments per month for people to be triaged to in order to access care. We've reduced response times. There's actually 6 vacancies at EHS, which is an incredible feat considering the workforce deficit that we were left with from the former government.
I recognize the Honourable Member for Halifax-Armdale.
Madam Speaker, I would suggest virtual care is not emergency care. This is agreed on by the Canadian Association of Emergency Physicians. You can't reduce a fractured leg with an iPad. Speaker, this lack of progress is having a real impact on Nova Scotians. They can't get the care when they need it or where they need it. Last year, 13 rural emergency departments were closed more often when this government was first elected. This means, as I've said before, people have to do an ER scavenger hunt to find care when they need it, leading to delays in care. What is the government doing to address this serious gap in ER care, particularly in rural Nova Scotia communities held by many Conservative members?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. And I think it's really important to understand that the past is not the future, that we have an integrated healthcare system and all the time improving the ways in which patients are able to move throughout the system. Nobody is asking somebody with a fracture to move on an iPad. I mean, it's ridiculous to even consider that. But what it does do is the people who need other episodic care, they can now go to a pharmacy primary care clinic. They can go to an urgent treatment centre. They can be seen through virtual care. They can be seen through primary care. 94% of Nova Scotians are attached to a primary care provider. Emergency rooms are for emergencies. We start emergency care the minute you phone 911. The dispatchers are very, very skilled and able to support individuals, and no one should be afraid to present to an emergency department if required.
Order.